My name is Lexi. I'm an LPC. I'm sitting here with my colleague Sarah, a fellow LPC. We have been paged to St. Clair Hospital, the ICU, to deal with a patient and the patient's family who has been involved and has been shot. The family is his live-in girlfriend and two children.
So details on the family are limited, but we do know that Simone is our main contact. She is a 20-year-old female. CJ is the victim who was shot. This is his girlfriend. They have two children. Zaire is 3 years old and Amber is 4 months old. The family had witnessed the shooting at their home in their community. Currently, the victim is in stable condition in the ICU and is expected to make a full recovery. But we were requested by the attending physician to meet with Simone and her family based on her appearance and the ways that she was acting after experiencing this traumatic event. Hi, Simone.
Hi.
Hi. Are these your two little kids?
Yeah, so this is Zaire. He's 3, and this is Amber. She's 4 months old.
Hi, Zaire. Hi, Amber. I brought some toys for the kids if they want to kind of play over at the table over there while we talk for a little bit, if that's okay.
That would be great.
Great. So nice to meet you. I am a counselor here at St. Clair Hospital. Um, I was requested by the attending physician to kind of come in and talk to you about what had happened and um, really just connect with you and see how you're doing after everything that you guys have experienced today.
Sounds good.
How are you feeling?
Honestly, I'm just in such a state of shock. It has been such a whirlwind since this happened, and I just have not been able to get Amber to calm down through this. I'm just feeling extremely overwhelmed, and I'm not sure how to deal with any of this.
Yeah, this is an extremely stressful situation that you guys have been in today. Um, your response is absolutely normal, absolutely understandable for your position and wanting to protect your kids and be close to them.
It's okay.
So I think what you're feeling is very appropriate for the experience that you guys have just lived through. And definitely safety is a main concern. Your body's probably going to be feeling very on edge from the adrenaline and just the entire experience that you've just been a part of. How are you feeling about your safety right now?
I don't feel safe anywhere. I mean, this happened in my home where I'm supposed to be safe. And I've always known that it wasn't a good neighborhood. I'm not removed from that, but I don't feel like I can go back there.
Can you tell me as much as you're comfortable with about the events that happened?
Well, I was home with the kids as I often am. I'm often alone while CJ is working, and he was coming home, and all of a sudden I heard a bunch of commotion. I heard gunshots, which again, I'm not proud of that, but it's common. Um, and I went outside and he was just laying there.
Were your kids in the house when this happened, or were they with you and did they see him?
No, my kids were with me,
Okay.
and I just feel so much guilt. Like, is it that I'm providing for them? How could I let them go through this?
Yeah, that's a very difficult thing for anyone to see, and especially being a mother wanting to protect your children's how you're feeling is very understandable and very common. Um, in terms of feeling safe enough to return, do you want to go home or do you want to look at other resources, other places that you can stay?
I can't go back there.
Okay.
I don't know when that's going to happen again. Will I be next? Will Zaire be next? I have a 4 month old. I can't go back there. Where am I going to go?
Okay. We have resources available that we can definitely provide to you. especially while CJ is still here in the ICU. So you'll be able to have a safe place to go that's you're not going to be alone with your kids. We have women's shelters that take in families, so we can get you set up with somewhere like that, especially while CJ is in the ICU. And then once he's able to return home, we can also help you with potential resources to relocate if that's what you guys decide to do as a family.
Sounds good.
I know the police are doing everything they can to make sure that the area is safe too, so, if you have fears about anybody else in the neighborhood or any family that live close by, the police are doing everything that they can to catch them and make sure that that is a safe area. Looks like you got little Amber calmed down.
Yeah, this is the first time that she's been this way in days.
Well, you should be very proud of attending to her and being such a great mom in the situation and looking out for your kids as best you can.
Appreciate that.
Simone, I know this is a really difficult time for you, so I really want to make sure that you feel safe and have everything that you need for staying here for tonight. Do you have all of your medications? Is there anything that the kids need that you didn't take from home before you left?
I just got put on SSRIs recently for postpartum
Okay.
depression, so I don't have that with me. I'm also formula feeding Amber, and I would need that as well. I think the hospital said that they would help me with that though. But in terms of Zaire, he has a blanket that he likes to sleep with.
Okay.
He hasn't been sleeping, but I think that that would be helpful.
Okay. Well, thank you for sharing that list of things. We were able to get a nurse to get some formula and feed Amber. We're going to do everything we can to get you guys some extra clothes to wear and try to get Zaire's blanket so that you guys can be a little bit more comfortable in terms of sleeping tonight. I am going to get you a list of resources for women's shelters that accept women and kids. I know you're staying here at the hospital tonight, but I want to make sure that you have a place that you can go after that without having to go home. And then I do also want to schedule a follow-up with you. So I want to be mindful of you being around the kids and your schedule and wanting obviously to be near CJ. So if I stop by tomorrow morning to touch base, is that okay with you? Okay. I can tell that you're still very anxious, and I want to kind of help you calm down so that you can get some sleep tonight, hopefully, so that you can be a little bit refreshed tomorrow to be around your kids and play with them because they may not be aware of the severity of the situation at their ages, so they're going to be playing and kind of acting like normal. So I don't want you to be alarmed with them behaving in that way. And I want to make sure that you are comfortable and not overwhelmed by them and them behaving in that manner. We also do have childcare available here at the hospital as well. So if you do need just some time, or if something is going on and you need to make sure that they're in a safe place, please let myself or other staff know and we can get them to the childcare so that you can do what you need to do. It was a short session, but I wanted to really just check in with you, let you know that we do have resources available and make sure that we connected to get more appointments on. Before I leave, I just want to do some deep breathing with you because that can really help calm the nervous system. I know it's not going to take away those thoughts and fears, but internally it can help bring down some of those senses and bring down some of that adrenaline that's kind of keeping your body racing. So this is square breathing. We do it with a lot of our patients who've experienced trauma, and it's super easy. You can do it without anybody noticing. So if a doctor's talking to you or if anything else happens that you feel highly overwhelmed, this can be something that can potentially help bring down some of that senses. So all we're going to do is breathe in for 4 seconds. We're going to hold it, and then we're going to breathe out for 4 seconds. So in through your nose and out through your mouth. So we'll do a couple rounds of it now and see how it feels. So 4 seconds in. Hold it. Out through our mouth. 4 seconds in. Hold it. Out through our mouth. We'll do 2 more. In through our nose. Hold. Last one. In through our nose. Hold it. Out through our mouth. How are you feeling?
I definitely feel a little bit better. I don't feel like I've actually been breathing this entire time until now.
Yeah, we can hold our breath in times of stress. It's just a reflex that we have. So I'm glad that you like that and it was helpful for you. I'll get you some resources. Feel free to sit tight. I know the nurse is going to bring Amber back in a little bit. And I will keep you up to date about the clothes and the blanket as well.
Appreciate it.
Absolutely. Let us know if you need anything.
Simone?
Hi.
Hi, my name is Lexi and I'm a counselor. I'm here to help.
Hi.
And who do you have with you?
This is my daughter Amber and my son Zaire.
Hi Zaire, hi Amber. I do have some toys. I know you don't want to be separated from your children right now, which is completely understandable. However, just right over there, I have some toys if you think that that would be something that Zaire would enjoy. And we also have a nurse that attends to newborns and babies as well.
Okay. Zaire, do you want to play?
Okay. All right. If you just want to follow me over here. How are you?
I'm okay. I'm doing okay. It's a lot to take in and I don't know what to do about the kids and I haven't eaten. They haven't eaten anything and we haven't slept and I just feel very overwhelmed by everything.
Sounds like you've been through just a whirlwind of events. I do have some things that can hopefully make you feel a little bit more comfortable. You know, it is important to try to be able to get the nutrients you need. And so I have some water for you so that you can be hydrated. You don't have any peanut allergies, do you? We have some peanut butter crackers as well as, I know it's very cold in here. It's often chilly in hospitals. So,
Thank you.
all right. Are you feeling a little bit more comfortable in this moment?
Yes, thank you.
So I know that you said that you haven't been eating or sleeping. Have you been having any other physical symptoms since all of this transpired?
My stomach has been hurting for the past few days. I don't know if it's nerves or anxiety, but it's just overwhelming everything that happened. And I think that I feel sick thinking about it.
And has all of these symptoms been, for the past few days? How long have you been experiencing this?
Yeah, about the last 2 days.
Okay. Well, that is often something that happens. A lot of times we will have, stomach related issues, lack of sleep. That's all very common things that we see and normal when people are going through crisis. If that would continue for, a long time and exceed that amount of time that, we typically see, then I'm happy we can get you some referrals, some resources for that as well. So tell me a little bit more about, so that's how you've been feeling physically. What about emotionally?
Emotionally, I just feel like guilt and shame about the event. Like I spend a lot of time home alone, so I almost feel like it could have been me. So I feel terrible that CJ is here right now and struggling with this. I feel terrible that my kids experienced this. Um, like why haven't I made more of myself that I could move out of where I am living? Like, I know it's not safe for my kids to be there. Why haven't I done more to get them out of that situation?
Sounds like you're blaming yourself for everything that has transpired.
Yeah, because I feel like I just could have done more and made better choices years ago that we wouldn't be in this position if I would.
First and foremost, what you're experiencing, all of these emotions, all of these physical feelings, is completely and totally a normal response to an abnormal situation. Second, from where I'm sitting, I see a mom who is doing the best that she can and that the love is tangible for her children. I need you to understand that situations like these are tragic and not internalize and blame yourself for what has transpired. You are all survivors, and it's not something that you should be blaming yourself for.
I just want what's best for them.
So, with that, tell me about how are you feeling about safety now in this moment, about safety at the home.
I feel okay now being here surrounded by everyone. I don't really want to be alone. I really don't want to go back home. I don't want to take my kids back into that environment. I I don't want to. I do not want to go back there.
So the home, you do not feel safe in the home, and it seems like that's kind of an imminent source of threat for you and your family at this moment. So we have a lot of resources that we can provide for you. We have attachments to women's shelters that also allow children. So
Okay.
you, Zaire, and Amber can go together as a unit and
Yeah, I do not want to be separated.
absolutely, understandably so. We also have, if extended family is also a concern about in the neighborhood. I know that the police is doing everything they can to ensure that that immediate vicinity is being, patrolled. Um, but we can definitely give you resources towards the shelter so that you don't have to go there and that you can focus on, being here for CJ's recovery as well.
Okay.
Um, how are you feeling in this moment? It seems as though you're very stressed out still. I can see that you're kind of.
Yeah, I felt this way ever since it happened. It's like I can't take a full breath. It's like everything just feels tight.
So I wanted to try a breathing exercise to kind of help with that. And while this won't take away all of the thoughts and the re-experiencing emotions that you're feeling right now, it can at the very least help bring your nervous system down. And the nice thing about this is you can do this at any point, even if, you're speaking to the doctor or you find yourself getting to that heightened state and nobody has to know that you're doing it. So what we're going to do is a breathing technique. It's called diaphragmatic breathing. That's just a fancy word that when you do it, I want you to focus on pushing out your belly
Okay.
and having the air be in your belly. So what we'll do is we'll inhale for 5 seconds. I'll have you hold it and then we'll breathe out of our mouth. Are you comfortable with trying that?
Yeah, I think so.
So we'll breathe in, 2, 3, 4, 5. Hold it, 2, 3, 4, 5, and then out through your mouth. 2, 3, 4, 5. We're going to do it again. Inhale. 2, 3, 4, 5. Hold it. 2, 3, 4, 5. And breathe out. 2, 3, 4. Do it again. Inhale. 2, 3, 4, 5. Hold it. 2, 3, 4, 5. And breathe all that anxiety out. You can do that anytime you feel yourself getting lost in those rapid thoughts, or your heart rate doesn't feel like it wants to come down, or you're feeling all of that extra anxiety. Okay, so sometimes when we are in crisis situations, we have a tendency to withdraw and isolate ourselves. So I did want to ask you a little bit about your social supports. Is that something that you feel that you have? Is there anyone that you feel safe with and comforted by?
Yeah, I have my mom and my sister.
And does your mom and your sister live near you? Is that somebody that you would be able to, have childcare with or go and stay with since you don't feel comfortable in your home right now?
I really don't want to go stay with them because they live in the same neighborhood, and
Okay.
I don't think the neighborhood is safe.
Okay, so that imminent threat is still there. Well, what I can do is I can provide the same resources for your mom and sister, for the different shelters that are in the area, the different places for childcare if your sister has children, and resources if that's something that you feel that they would benefit or like. I'm
Okay.
happy to do so.
Okay.
I also wanted to see if there was anything that you needed provided for you if you're going to be going straight to the shelter, any medications, any things for the children that we can help supply you with.
Yeah, I don't have any clothes for the kids or formula for Amber, and Zaire hasn't been sleeping, and he has this blanket that he can't sleep without, and I didn't bring that. And I left my medication at home for my depression.
Okay, well, we can definitely get those things, try to get Zaire's blanket for your depression medication. I know how destabilizing a crisis like this can be, and I just wanted to make sure that in this moment you don't have any thoughts of harming yourself or thoughts of harming others.
No.
Okay. So what we'll do is we will take steps to get hopefully Zaire's blanket. We can get formula provided for you through the hospital. I
Okay.
know that they also have other resources like clothes and stuff available at the shelter. So we'll make sure that you have all the things that you need, when you get to the shelter as well.
Okay.
Do you have any other concerns in this moment? Any other needs?
No, I just want to be back with my kids.
Okay, well, we can get, your kids back with you. They've been in the playroom and with the nurse, and I'll make sure to have all of your resources easily available for you. Right now, the most important thing is just to try to make sure that you're, getting ample rest as best as you can. Make sure that you are eating, using those grounding techniques and the relaxation breathing. And we can also set up some referrals if you feel necessary for either like a one-on-one session with the children or another one to touch base with you in a few days as well.
Okay.
Would you be okay with me stopping back tomorrow just to see how you're doing as well as provide you all of those resources?
Yeah. Yeah.
All right, great.
Hi, so we're back to talk about our psychological first aid on our case Simone that we just presented to you earlier. We want to go through the psychological first aid components provided and kind of analyze how both of us feel we did during our section. So we're going to start with the contact and engagement. Both of us, I think, initiated contact in an appropriate manner and asked about immediate needs. I think that Lexi was a little bit stronger in this area with providing food and a blanket and other resources for the character Simone, and just being a little bit more proactive with having those things available.
That being said, I did feel that Sarah was very present in the moment. I had that one-on-one contact, and I definitely felt that my immediate needs were met. So for safety and comfort, Sarah did make sure that I felt safe in the hospital in which I was at and attended to both of my children. She provided toys for my 3-year-old or the client's 3-year-old and also provided childcare for the 4-month-old. We didn't get into things like talking about traumatic grief or death just because in our case scenario, CJ, the boyfriend that got shot, was not, he was expected to make a full recovery. So that was not something that we had to go into. Um, let's see.
Something that we did talk about, between takes between Lexi and I's was the idea of, like, physical contact between the counselor and the client, and it was interesting to see our differing approaches. Um, I feel like my experience with my supervisor at my placement, I feel like she would be very anti that, so that was very interesting for me, whereas Lexi felt like it was more comfortable to have that physical touch to hold the person's hand to make that connection. So, I think it was a good conversation for us to have to see different perspectives.
Absolutely. In that moment, the engagement with hand holding was done to provide a level of grounding. My client was very in a heightened state. And in order to ensure that we had that one on one connection and maintain eye contact, I felt that it was something that would be beneficial. This is done, of course, with the client consenting to this and being okay with that. She actually went and grabbed for my hand, so I felt that it was appropriate in that moment. In terms of stabilization, um, we did both use grounding techniques in the sense of breathing techniques in order to just get the client to come to a lessened state in their, central nervous system response. For information gathering, I feel like Sarah did a better job at gathering information on the basis of what actually transpired. Whereas when I did mine, I was a little bit concerned with not wanting to have the client relive those traumatic details. So I didn't ask specifically what had transpired outside of just the basic knowledge of being called in for a shooting.
Yeah, and I think our conversation, prior to us starting about how we felt about that was good information again to get those different perspectives. Um, Me kind of coming from a place of just having the client share what they're comfortable with, and making that the barrier of, like, if that's where they're comfortable going and I can get the beginning parts of the information that they don't get too deep, or if they do want to talk a little bit more about it and like work through some of that experience, letting them be the guide for how deep we get in that conversation.
Both of us talked about feelings when we were clients of guilt and shame of being in situations where, Simone having these two children, they experienced witnessing this crisis. And I feel that we both attended to those feelings in our own ways. Um, One thing that was not brought up when I was the client was the thoughts of harming self or others. However, I do feel that in many other ways, Sarah, as the counselor, made sure that that was not a prevalent issue imminently at that time. Um,
I think another area that I lacked in mine as well was asking about social supports, and like finding out where Simone was with family and friends and other people that were around her because she did talk about loneliness. Whereas Lexi brought up like who lives around you, what family members are close by, that you can kind of connect with.
Sarah did a really great job of normalizing all of the stress responses that I was detailing when I was the client. And she also was very strong in her providing of supports. She seemed very knowledgeable about the supports that could be provided and what these things would look like moving forward. Whereas I feel like I kind of was a little bit tripped up with that. She immediately talked about setting a second time to touch base with the client and to be able to have the client have access to all these supports, as well as assisting the client with the things that would be needed if she went to the women's shelter, things like her medication, comfort items for the 3-year-old, as well as making sure that there was formula for the baby.
In terms of practical assistance, I think Lexi did a really great job with identifying the most immediate needs in terms of food and water and sleep and where the children were. I think she did a really great job of identifying those and making sure that those were taken care of before she dove into any questions with Simone and really digging into that trauma. I think that's really important to make sure that before you get into anything, you make that connection with the client. So I think that that was really good that she started there before getting too deep with anything else.
One thing that neither one of us, I feel, really touched base that we both feel is very important. And if we were to do this assignment again, we would definitely, but we also did talk about the time restraint of first and foremost, we want to make sure that the client isn't in imminent danger and feels attended to with their safety needs. So that's one reason that we didn't get heavily into the past or pre-existing trauma stuff like substance abuse problems and psychological problems. We did, however, speaking to Simone and her necessity to have her depression medication, we obviously are aware that there is treatment ongoing for, some mental health pathologies. However, had we had more time to engage deeper, that's definitely something that we would have both looked into.
In terms of information and coping, I think we both provided information on stress reactions, how your body talks about that. Lexi did a great job of describing some of the physical symptoms, and looking back, I wish I would have done that as well. We did some relaxation techniques. We talked about how those negative emotions can sometimes appear both physically and mentally. We did not bring up anything about substance abuse, which, given the way that Simone was talking about the community that she lives in, I think was kind of a missed opportunity on both of our parts. That we could have gotten some more information, maybe even about the event that happened, if we would have brought up substance abuse.
Both of us, I feel, were strong with assisting with our developmental concerns for the children. I know that in both of our tapes, we spoke about having potential one-on-one sessions with the children or having sessions that involve the children in order to try to help against the experience of ACE related either physical or emotional symptoms following that. Um, And I also feel that we were both really strong, and I want to make note of the modeling of supportive behavior. We were both very much in check, giving Simone our full attention. And that's something that even if she does struggle with having social supports, she can see the modeled behavior of what it is to be supported post crisis.
So I think overall, our high areas that we felt really good about were our ability to be attentive and provide immediate needs to Simone, provide her with resources outside of here, and really make sure that where she was currently in the moment was safe, even though her emotions may not have been giving her that same feeling. Some areas I think we can agree on needing to work on a little bit better is definitely bringing up drug and alcohol abuse, past traumas, and kind of seeing how that ties in, because that could very well change their response to this specific event. And there was one more. Oh, identifying and developing an action plan. So we both provided what our next steps would be, but I think again, time permitting and being in a more real life situation, writing that action plan down and providing it to the patient, because, or to the client, because they're probably not going to remember a lot of what you talk about, given the timeline of that traumatic event just happening and them still kind of being in shock. So providing a physical copy of something before you leave the room could be better for them to like refresh their memory after they calm down a little bit and are looking for those resources.
And it is, important in closing to note that the referral we did speak about possible referral to mental health sessions, as well as coming back and doing that second check-in that is often something that is done just to re-communicate the things that were talked about. And as you said, since the client is in a state of shock and, probably won't remember, that's another way that you can make sure that they're getting these other community services and assistance.
Overall, good job.